Hello, everyone. My name is Samar Robleh, and I'm a graduating senior studying public health with a concentration in population data science at San Jose State University. Before we begin, I want to thank the Research Colloquium for letting me present to you all today. I also want to thank the SJSU McNair's program for funding this study and my faculty mentor, Dr. Miranda Worthen, for the guidance. Moving forward, I'll be presenting my qualitative research study titled Suffering in Silence, Examining the Stigma of Mental Health Affecting Young East African Women. This research is of a great importance to me as a fellow East African woman, specifically as a Somali woman, and as a future epidemiologist. As somebody who has seen a lack of scholarship that focuses on Black immigrant communities, especially in the field of mental health, I'm hoping that my research will be a step towards closing that major gap. From a very young age, I never once heard the term mental health used in a positive manner in my familial language, or even had conversations surrounding mental health amongst my family. As I grew older, having these type of conversations became more common among friends from a similar ethnic group than turning to my family. I realized that among my friends that there are similarities in all our situations. All of us did not grow up with a healthy grasp of mental health, much less knowing the language that could be used to describe the days we felt depressed, anxious, and other tumultuous feelings. For my background research, I was shocked to find such little research on Black immigrant communities and mental health, especially on East African communities since they've been a steadily growing population in the United States. There were some articles about the undervalue of research toward these communities, which results in a lack of health intervention and support services. Most importantly, there was also a lack of focus on children of immigrant families and their relationship with mental health. As a researcher, I had the goal to investigate this phenomenon. My methods, this was a phenomenological research study that centered on East African women from the ages of 18 to 25 and was based in California. The study was conducted using semi-structured interviews that consisted of about 8 questions. The questions themselves were not as rigid, and everything was meant to generate conversations that were meant to have the participants speak on their experiences or in terms of their opinions about in regards to mental health, how was it for them during their household, to how did they engage with it as they grew older. Everything was done over Zoom. The interviews were transcribed electronically to find themes used in this, they'll be shown in the finding slide, to capture the lived experiences of these young women and the reasoning behind the stigma of mental health amongst the population. As you can see, there were a myriad of findings that were very similar to how I grew up and also similar to how my friends grew up, where mental health is seen as a weakness, and how the comparison of our trauma or, why should we be sad when our parents have gone through much worse. And the reasoning for how we engage with mental health comes from our parental influence. The impact of war-related trauma and its link to mental health has been noted in decades of research. Recently, the emerging topic of intergenerational trauma or transgenerational trauma has been prominent in the literature surrounding the after effects of severe traumatic experiences such as ethnic cleansing, genocide, and violent instability in marginalized populations. As indicated in the findings, the parent-child relationships have clearly shown the deep ties that intergenerational trauma has to mental health, as intergenerational trauma could pass on emotional, mental, and physical stressors to subsequent generations. Despite the lack of emotional nurturing from their parents, these young women managed to receive it from elsewhere, school-based settings where there was access to resources and professionals to service their basic needs. However, there was talk amongst me and the participants about how there is a lack of accessibility when it comes to mental health services, especially in obtaining it in a non-academic setting. In conclusion, despite research and policy attempts to address health inequalities among immigrant communities, African immigrants remain the least researched immigrant group in the United States. In turn, that results in a myriad of issues regarding health needs being unmet due to a lack of research in specific population and a growing population that encompasses a variety of cultural backgrounds that influence health practices and mental health beliefs. Thus, there needs to be more research on the impact of intergenerational trauma within the East African community to lessen the stigmatization of mental health and bring awareness to more needs that can be attuned to these community needs. Here's my contact information, and thank you.